Welcome to Your Health. I'm your host, Rhonda Alfred, and today I'm joined by Dr. Sindhura Bandaru, endocrinologist and obesity medicine specialist at Terrebonne General Endocrinology Care. She's here to discuss with us endocrinology and what it means to be certified in obesity medicine. Thank you for joining us.
My pleasure. Thank you for having me.
All right, well, please, let's get started with you telling us a little bit about yourself and your role at Terrebonne General.
So I was born and raised in India, did med school back home, always had the dream to pursue my higher education in the United States. So I moved here for my residency, did my internal medicine residency in Southern Illinois University, Springfield, Illinois, and subsequently did a fellowship in endocrinology, diabetes, and metabolism at the University of Wisconsin-Madison. Upon graduation, moved to Homa for my first job, joined the Terrebonne family, and I treat diabetes and a variety of endocrine-related problems.
Okay, well, we're so glad to have you here.
Thank you.
In Homa. Tell us a little bit about what is endocrinology.
So endocrinology is a branch of medicine that deals with endocrine systems, which are important in hormonal regulation. Hormones, we often refer to them as messengers because they help different parts of the body communicate with each other. So it basically deals with all the endocrine organs, endocrine functioning.
Okay, and what type of conditions do you treat?
So we treat diabetes, thyroid, parathyroid, adrenal, PCOS, gonadal, hypogonadal issues, osteoporosis, metabolic bone disease. The other things would be transgender, cross-sex hormone therapy, are few of the things that we treat as endocrinologists.
Okay, what is the most common?
Diabetes is the most common thing that we treat around here. Yeah.
Okay, and how do you help patients manage their diagnosis?
So it depends on what type of endocrine problem they have. Let's say they have some kind of endocrine problem causing a hormone deficiency. Just giving the hormone back, replacing that itself might be enough. But let's say if they have excess thyroid hormone production, then it might require surgery depending on what is the underlying problem. Let's say they have too much of cortisol production because of a tumor in the adrenal gland or some tumor in the pituitary gland stimulating excess cortisol production, so we have to do a surgery. Or let's say they have some kind of thyroid problem like Graves' disease, resulting in excess thyroid hormone production, then sometimes there are certain medications like anti-thyroid medications, sometimes it might require surgery. So it just depends on what type of endocrine problem they have.
Okay. So you'll have the solution, hopefully.
Yes.
All right. Well, you recently got a new certification in obesity medicine. Tell us more about that.
So, yes, I'm happy to share that I'm now an obesity medicine board certified physician. So I'm a ABOM diplomat. The reason why I wanted to get this certification is number one, obesity is the most prevalent chronic disease in our community. Obesity causes a variety of endocrine problems like type 2 diabetes, PCOS, hypogonadism, not only endocrine problems, but a lot of other medical conditions like obstructive sleep apnea, osteoarthritis, varieties of cancers, mental health issues, hypertension, hyperlipidemia, it increases the risk of heart attack, things like that. So obesity is highly prevalent, like I said, in our society, and I wanted to further expand my knowledge in the field of obesity medicine. And I think the knowledge and education that is required to take this certification is of the greatest value. Throughout my process of preparing for this certification, I realized how complex obesity is and all the signs of obesity. So it helped me further expand my knowledge, gain more confidence in treating obesity, and help my community.
Okay, well, great. And so what impact have you found this is having on patients?
Because I treat diabetes, especially a lot of type 2 diabetes in this area, not only type 2 diabetes, but also infertility, PCOS, like I said, hypogonadism, or some of the consequences of obesity. It's helping me better treat my patients, do better counseling, not only from nutrition perspective, not only from medication perspective, but also like kind of explain them all the pathophysiology, because having a better understanding of disease also helps them better better manage obesity. It helps them get motivated and understand why they have to do certain things. Why is lifestyle modification very important when it comes to managing obesity?
Right. Well, that's wonderful. Understanding is half the battle, right?
Right.
So how do you help them from an endocrinology standpoint?
From endocrine standpoint, when it comes to obesity treatment, I do the nutrition counseling, exercise counseling, the goals for physical activity, all the lifestyle changes. So I do that counseling. In addition to the lifestyle counseling, I also prescribe medications for obesity. And I go over things like when do you have to consider bariatric surgery. I'm not a surgeon, but at least I can go over those details as to at what point you consider bariatric surgery, what are the different options, what are non-invasive or relatively less invasive procedures like endoscopic devices if someone is not interested in going for bariatric surgery. And when it comes to medications, they need to be on medications long term to see the weight loss effect. So I basically focus more on medications. And like I said, medications or surgery or any intervention, that's always in conjunction with lifestyle changes. So I also do the counseling from that aspect.
So it is about lifestyle changes.
Right. Lifestyle plus medications is where I play a big role when it comes to obesity management.
For more information on obesity medicine, please visit tghealthsystem.com or call Terrebonne General Endocrinology Care. Thanks for being with us on To Your Health. I'm your host, Rhonda Alfred, and I'll see you right back here next week.